Gastric acid neutralization or antacids. So what's their mechanism of action? They neutralize acid in the stomach. So it does not prevent the overproduction of acid. It just neutralizes the acidity, right? So those are completely different things. Now they do stimulate mucus, prostaglandin, and bicarbonate secretion from cells in gastric glands. So what do they do? Why is it so important to stimulate the production of mucus, prostaglandin, and bicarbonate? So mucus, it helps as a protective barrier, so serves as a protective coating against the digestive action of hydrochloric acid and digestive enzymes. Meanwhile, prostaglandin, although prostaglandin has different effects in different parts of the body, right, in the stomach itself, prostaglandin actually helps protect the lining because prostaglandin prevents histamine binding on parietal cells. So that helps with the acidity and protection of its lining. Now, bicarbonate, on the other hand, it's used as a buffer for hydrochloric acids. So buffer means it prevents changes in the pH of the stomach because it buffers hydrochloric acid. So what are the therapeutic effects of antacids? Well, mainly, they relieve symptoms related to hyperacidity. Indications or reason why we give antacids or gastric acid neutralization agents are heartburn, gastritis, and peptic ulcer disease or PUD. Precautions, they may inhibit absorption or activity of other drugs taken concurrently just because that can be influenced because of the change of acidity. Now, contraindication, definitely GI obstruction, right? So magnesium antacids may be contraindicated for patients with small bowel obstruction due to the laxative effects, and as well as there are possibility for renal failure. So it's potentially toxic, especially when it accumulates because it does affect the electrolytes. So we have to be very careful when administering this kind of medications. So side effects or adverse effects of antacids. So magnesium preps, it can cause diarrhea, increase in magnesium, right, or hypermagnesemia, especially in renal failure patients. There are also medications which contain aluminum and calcium. So the aluminum and calcium preps can actually cause constipation and kidney stones for calcium preps because of the presence of too much calcium. There may be instances when it can cause rebound hyperacidity when used long term, right? So this is going to be very similar to what happens with the congestants causing rebound congestion, right? So rebound vasodilation. So in this case, there can be a rebound hyperacidity when used long term, right? Our body becomes dependent, sometimes because of discontinuation or even the loss of effect. It can cause increase in acidity instead of actually helping with acidity. Now, and it becomes hard for patients to stop taking antacids because they become dependent because of that rebound hyperacidity that happens after discontinuation. Now, metabolic alkalosis, so basically this happens because of over-neutralization of stomach acid. So now we suppress all the acidity, right? Instead of being acidic, now it becomes more basic. So we have to be very careful when it comes to the side effects and adverse effects. So nursing actions, as always, we have to assess for therapeutic and side effects as well as follow-up or evaluation, right? We need to know, did it work? Did it cause some side effects, right? And also, as always, patient education. What's the use of the medication? When to follow up? What are the possible side effects? And so on. Now, the drugs that you have to remember, the ones with the asterisk, so you need to know your prototypes. So you have milk of magnesia, also known as magnesium hydroxide. You also have amphogel or aluminum hydroxide, Tums or calcium carbonate, Mylantar Maalox, which is aluminum hydroxide, and magnesium hydroxide. So as you can see, the main ingredients are your electrolytes, right? You have magnesium here, aluminum, calcium. Here you have aluminum and magnesium. So when we're assessing our patients, right, in addition to doing our physical assessment, we need to keep in mind what are their electrolyte levels, right? If we know something's gonna affect their electrolytes, then we want to know what is it before and then what is it after. Those are the things that are very important to analyze when giving this kind of medications. Obviously, in addition to your signs and symptoms and any relief of those symptoms.